Good day, folks. Alfie Venta here once again at Venta Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. We have a second case study here, soft tissue case study. Patient complains of annoying chronic headaches. We had our first one, and we want to thank you for those of you guys that tested out our first case study. These case studies are based on some of the treatments I have given over 20 plus years. Most of them are a combination of different cases I've dealt with, and I've made them into one case. If you're a massage therapist or a professional, such as a chiropractor, physiotherapist, physical therapist that really focuses on the fascia and the muscles, this might be something that you might be interested in. I do encourage you to have a pen and paper. If you have your laptop, take some notes down, because this is actually part one of the case. The second part will be a answer and discussion, and that will be the following week. If you like this content, by the way, please like, share, subscribe, and if you're on YouTube, please hit the notification bell. Also, you can share this with other people that you feel this might be helpful for. For example, if you're an instructor and you think that this content will be helpful for your students, I encourage you to pass it on. We want to thank you way in advance. So now let's get on to the soft tissue case study here. Patient complains of annoying chronic headache. Your patient client comes to your office and they mention to you that they have had chronic headaches for a few months. They have tried many different therapies and usually feel better for a day. The treatments generally focus on the neck, head, and shoulders, so it seems to be very local in terms of the treatments that they have generally gotten. The headaches return with the same low-grade annoying quality by the second day. Your patient client is slowly becoming worried. She has had multiple Western diagnostic tests and all are negative. So in these cases that I present to you, just follow with whatever I have written down in terms of the key observations, in terms of the case study itself. Reason being, you don't want to be assuming too many things because it could really bring you into a real weird path in terms of trying to figure out what this case is about. So on with the case. On the health history, it is noted that they had a bad case of the flu that lasted for a few weeks before these headaches started. This individual had fits of intense coughing and also had at times difficulty breathing. She is feeling better now. So this, I underline, is one of probably the most significant part of the case. So please take note of that. On a hunch, you decide to assess her breathing and palpate around her rib cage. You notice that there is a significant degree of muscular and fascial restrictions around the abdominals and rib cage. You also notice that when you ask the patient client to take a deep breath, that their inhalation seems very shallow. This patient client mentions to you that their headaches seem to travel from the temples to the top of the head. They also mention that they are noticing a plugging sensation of the ear and that every once in a while they feel off balance. She just wants the headaches to disappear. So there you go. That's your case study for this one. And now we're going to talk about the key observations. And as I mentioned before, these are the most important things. Don't overassume too many things, because again, it'll lead you astray in terms of this actual case. So this is what you found, standing before her and assessing her. She's got a head forward position. The swallow test is positive. If you've forgotten it, if you're not sure what the swallow test is, you could take a look at your textbooks. You could look at McGee. They have the swallow test there. Palpation of sternocleidomastoid and suboccipital show extreme tightness. I also want to add to this that the sternocleidomastoid is actually relatively tighter than the suboccipitals. Upper trapezius is incredibly tight, and when patient client relates to you that there is referral to the temple, so they're getting headache towards the temples. Neck and head range of motion seems limited through rotation and lateral bending laterally. So when you're doing this, bilaterally, and it's limited through rotation. More of the key observations. Shoulders also seem more elevated than normal. Rib cage and abdominal muscles and fascia are extremely tight. Generally, intercostals and diaphragm are tight and tender. Kyphotic posture is observed when patient client is prone. So when they're lying on the stomach, you notice that they're kind of more rounded like this. Thoracic segments are hypomobile when challenged towards the anterior direction and lateral direction. So when you're doing some mobilization of the joints, it just doesn't seem like it's moving well. It seems to be very, very stuck. So those are your key observations. Now, for the next part, these are the critical thinking questions. So be sure to write these things down. Think about it. Because I think this is a great puzzle. I think for many people. So number one, what do you think is directly causing the headaches? Number two, what structures do you think you will need to focus on? If you were to rank from degree of importance from 1 to 3, 1 being most important and 3 being relatively the least important, how would you rank the structures? So I know that there's probably 5, 6, 7, but for now, 1 to 3, rank from 1 to 3 in terms of the degree of importance, in terms of what you would be looking at and what you would be treating, what structures. Number 3, reasoning this out, just based on the case, why do you think this issue has become chronic? And finally, number 4, mechanically speaking, how would you explain how this patient client got to this point? Explain the root cause and instigating factors. Now, I know there are many of you guys that will be thinking one certain way. Write it down still. And in the second part of this case, the answers and discussion, I would really like to see some of your thinking behind and the reasoning behind why you thought a certain way, with comments and stuff. So those are your critical thinking questions. The answer and discussion video the week of September 16th on LinkedIn and YouTube. So any two of those platforms, you'll find the video. It'll be sometime within the week of the 16th. So again, just pay close attention in terms of in case we put out announcements for it. Thank you for watching. We really appreciate it. Again, if you like our content, please like, share, subscribe. Hit that notification bell if you're on YouTube. Also, follow our social media and visit our website, invvite.com, and we also have vprc.ca, our pain relief fitness website. We really appreciate you guys watching and doing this case study. I will have more case studies in the following weeks. Have yourself a great day. My name is Alfie Vente, once again at Vente Pain Relief Clinic and vprc.ca. We will see you soon. Take care.